I wanted to touch on COVID-19 because, as you know, the questions are far more important than the answers. I've been getting frustrated, and I'm sure others are, with the numbers that I'm seeing and how people are interpreting the numbers. And since you're an expert, I wanted your opinion. Here in Panama, the populace tends to focus on a couple of data points, one of them being new cases in one day. We had 850, I think, a couple of days ago. There are a little over 20,000 positive cases now, about 430 deaths, if memory serves. And so there's these numbers are coming out and people focus on them. And I've been thinking, wait a minute, we have 850 new cases in one day. What can we ask to get better clarity, more insight into, okay, great, 850 new cases. What else is there to talk about? I don't know. What do you think?
Well, the first thing I would ask is where were those 850 cases from? Or those are just random walk-ups that, hey, I just want to get tested? Because in our community, we're just now starting to do literally random testing. In fact, this week, I think in 2 days, they're going to open a testing facility at our civic center, and it's just, if you want to get tested, come get tested. So literally, there could be 1,000 people that show up, no symptoms, and just want to get tested. And what does that mean? So then it gets super technical about what your prevalence in the community, how much is in the community already, and there's going to be a lot of false positive tests and those, just randomly testing people. So are those, when you get a big hunk, okay, 700 new cases, okay, so my question would be are those just randomly tested people, or are those coming out of hospital ERs? Are those symptomatic patients, yes or no? Because a large portion of these are people without symptoms. Just in our little office here, we've only had a handful of patients that have tested positive, and almost all of those are people without symptoms. They don't have symptoms. They've just either their work has made them get tested, to come back to work or something. Mm-hmm. They tested positive. And so then the ultimate question for me and what we monitor here is, okay, so how many people are being admitted to the hospital with illness? What's the hospitalization rate? How many people are in the ICU or being transferred to ICU with serious COVID-19 infections? So how's our ICU bed level? How's our ER bed level? And how is the admissions to hospital? Is that changing, fluctuating? In our community right now, it's really not changed a lot. We're not seeing a lot more people being put in the hospital with COVID-19. It's staying somewhere between 4 to 6 to 7 people in the hospital daily, basically. So it's not shooting up. You would think, okay, well, if you got 800 new cases, wow, there must be at least 50 or 60 people in the hospital with it, but that's not what we're seeing. So if you had a magic wand, you can know, okay, how many of those are asymptomatic when you get those new numbers? Not that they're not insignificant, but these are, there's an economic significance to this, because for the most part, people are like, okay, you're stuck now. You can't do anything for 2 weeks. So employers are going to use employees. They're going to be out of work or either try to work from home. So there's huge economic significance of it. But from a medical standpoint, it may mean nothing, because most of our patients that have had it are just not ill with it. In our community, we've had 9 deaths, I think, for this whole entire year of COVID-19, and 99% of those were people who were elderly and had multiple medical problems.
That seems to be same here in Panama.
So the sickness, that's the question. Are people sick from it? That's the ultimate question, because it's just another cold. Yeah, those people need to be protected and stay away from elderly and the people that could really cause problems. but in and of themselves, for that individual, is probably not going to do a lot of damage that we're seeing right now.
Yeah. Well, the key is how are we measuring progress? And that, I guess, is still up in the air in terms of opening back up, and
Yeah.
a lot of questions remain.